This conference will
Oh, you
now
guys
be
can't hear
recorded.
that. You probably can. Uh, so Ellen asked about Hashimoto's and how to treat it. Okay. So, I mean, those are the kind of things we talk about in seminars. There is no real protocol. The protocol is basically this. You got to learn the show method. Okay. The show method is, basically out of these things here, where you have all the basic chemical detoxifications, basic infectious agents, and all these things. And you need to clear them. You need to, you need to establish a healthy metabolism, and you need to empower the immune system to start cleaning up. As you use the IMAID, you will see that people are full with infections, chronic infections. I mean, including infections that you inherited from your parents. So Hashimoto's, for example, okay, is basically slowing down of it's hypothyroid. And I cannot, besides the basic show method protocol that you need to do really on everybody for everything, is there's two items that one needs to look out for. One is iodine, an allergy to iodine, and the other one is a chronic Epstein-Barr virus infection. Okay, which okay, you can put. Let's just put into the search function EBV, Epstein-Barr virus, and see what comes up. Only one. Okay. Because it's in there multiple times, and it's in other panels too. This is virus 15. Now you could always also do. I happen to know that virus 15 is Epstein-Barr. Okay, and there's another version. So anyway, those are things as far as Hashimoto's. And by the way, the same is true for Graves' disease, which is the opposite, which is a hyperthyroid. You will find, if you start looking, and so anyway, eventually, if you work with these folks, eventually you will, eventually it will come up in a scan. But at this point, I don't wait for it to come up in a scan, because I guess the way it works is it kind of comes up in a scan when actually your immune system is capable of fighting and attacking and removing that virus. If it's buried, there's so many chronic infections going on in people that the software doesn't necessarily pick all that up, in the first couple of scans. It picks up the most severe things first, and so after having done some basic food allergies, if someone has a diagnosis of Hashimoto's, for example, I will manually test for the Epstein-Barr virus with a vial, and that that happens a lot. So it's always good to have the test kits also to do that kind of sorting out. The test kits you can find also on the Smart Health website. Of course, you can make your own. You just as we just did. You type in Epstein-Barr virus, right? And then so now you put I can put what is it called? A vial on the interface box. Okay, click on this thing here, on the frequency here, and just do 1 minute of imprinting, and you've got yourself an Epstein-Barr virus, Epstein-Barr virus vial. Okay, and then you can test manually if you like. Now there is some other avenues. Theoretically, if you have time, I do this for time reasons because the vials are really quick. You could theoretically, if the person is hooked up, or you could just dial in the frequency like this and run it, okay, quickly, and then and now muscle test and see if they react to that frequency. That will be another way of doing it. If you're comfortable with that, you can do that too. So iodine and Epstein-Barr virus are very, very often involved in all thyroid issues. for that matter, whether they're cysts or whether they are just thyroiditis or Hashimoto's or Graves' disease. All right. So someone, I think someone from Europe was asking about spine and emotions. So let's talk about that. All right. So let's say you have a spinal panel. You're dealing with back pain, or just not necessarily just lower back pain, but just back pain, which includes the cervical spine. You can come here and you can run a scan, and you may find that this is quite powerful. Okay, and here you would always do the color coding is automatic. It's red, yellow, and blue, and you can just do the default feedback, which will be down here, of course. And you may find the feedback is always rather positive, that it takes the inflammation out, or just the pain, but it does it by, reducing the inflammation in the area. And so, but what you may want to do, especially if you have the impression that there may be some, emotional issues involved, is combine it with a treatment from this panel, okay, and run a test potential. And these emotions are directly related to back pain issues, not just lower back, but the entire back. All right, so you could come here first, actually, and then follow up with a spinal, or the other way around. I don't really know which is better. I don't think one is better than the other, because you're doing it in the same session. Probably, I would, it's something to muscle test. I haven't really established a pattern which is better. But these two go together very well. Something to consider. And then, as always, your time, you're talking about 20 minutes as an average feedback time. So now, while we're talking about doing multiple panels, so, one thing you don't want to do is just do too much in one session. I wish everybody could do one session every day, and that would be great. Of course, there's not necessarily time to do that, and as far as patients or clients is concerned, it gets to be a little expensive, which is why people can really treat themselves with this technology too. So, if by the way, if you have a client who can afford a system, which is really very reasonable, we pay $1,000, whatever you call it, bonus or something. And it is now available also without the hardware, just as a Metaspace function, which cuts everything in half, the price and the bonus for that matter. But okay. All right. Spine and emotions. So hold on. Let me ask. So Angelica, can you speak in English?
Of course, I speak in English. Yes, yeah, fine.
I think that question came from you. Did that answer?
That came from me. Okay, so I take the emotion and then check spinal relationship and go back to the column, to the vertebral column.
Okay.
Yes. Okay, that's good.
So
Fine for me.
Yeah. Okay. All right. What to do if vaccines show up in the detox panel? Well, okay. So detox, detox, of course, we have a seminar about detox. I'm developing, we call them an advanced seminar about emotions specifically and how to move them around to stop them from interfering basically with metabolism and epigenetic function. And I am developing a cancer seminar. But we'll talk about that next. Anyway, that's a big subject matter. And okay, what to do if vaccines show up in a detox panel? All right, so anyway, detox is huge. It's huge. You know, I had an interesting little experience just the other day with my business partner here. We had breakfast and we were talking about things. So he had pancakes and he put some Aunt Jemima syrup on it. And so the last thing he needed is, you know, is all that carb stuff. And I had bacon and eggs, and that was awesome. So then, you know, afterwards, you know, I'm trying to explain how this all works, and that everything is regulated by genes, right? And so vitamin B1 has a different gene set than vitamin B2 and B3 and B6 and B9 and B12. They all have different genes. I mean, there's some overlap, but they're all set, okay? They're all different genes that regulate the metabolism of all these nutritional items. There's hundreds of them. Amino acids, fatty acids, okay? So that's what we're doing in the allergen panel. We have broken down these, that's why NAET worked, even so they weren't aware of epigenetics and all that, because she had the genius of breaking it down into single nutrients, you know, like calcium and iodine and iron. So anyway, in order to make the point, I picked up this bottle of Aunt Jemima syrup, and I was going to read them the nutrition that's in there, you know, to say, so right now your body has to digest what you just consumed. And here is a list, and it's nothing but chemicals. There wasn't one nutrient in there. There wasn't even sugar in there. It was high fructose corn syrup and benzoate and all chemicals. So I was like, oh my God, no, you don't have to digest this. You have to detoxify what you just ate. And anyway, so detoxification is huge. It's huge. And there's thousands of genes involved, okay? And each chemical has a different gene associated with its detoxification. Okay, so, you know, let's say ibuprofen is detoxified by a different kind of set of genes than caffeine or a pharmaceutical or you know, weed killers and so on and so on. So, but as far as this panel here is concerned, so if you are confident that this body can handle, you know, detoxification is complex and it's a whole science of its own. There's different phases. There's phase 1 and phase 2 in the liver, just in the liver, and so on and so forth. And you really have to kind of be familiar with how to make sure that if you're unlocking certain toxins in the body, that they actually make it all the way out into the toilet. You can't take that for granted. And so I do recommend to take the detox seminars when they come up. Right now, I don't think right now one is, we're focusing on the immune system this fall. However, if you have the, you know, if this comes up and this is what you want to do, you just, yeah, if this came up red, you just do, I would never do more than 20 minutes with this. And in fact, I would maybe do 5-minute increments here. Okay, let's do 5-minute increments and then watch that rectified number. Basically, so vaccines contain all kinds of actually chemicals, you know, separators and preservatives and of course mutated or whatever it's called viruses and such, and it all has to be detoxified. So all I want to add really, besides, you know, I mean, the scan told you what is most important to detoxify, is then to maybe nutritionally support this somehow, either a chelation agent or chlorella or spirulina or one of those things, or any kind of cleansing, you know, supplement that you can come up with. to facilitate that the stuff actually leaves the body. You know, it's one thing to get it out of the tissue and out of the cells, but then it has to be, you have to make sure that it actually gets out of the blood and into the excreting organs like liver and kidneys and then the gut to be eliminated. But detoxification is a big subject. This doesn't really do it justice. So if it comes up, in the end, you always want to make sure you want to work with this panel a lot, allergens, okay? Because it has a lot of these toxins on there. And it will, and it also has some of the genes on there that are responsible for detoxification. Okay, for example, these are Cytochrome 450 genes. These are detoxification genes, and there's more to come later on this year, this fall, as far as, well, we're constantly expanding anyway. So now when you run a scan in this panel, okay, let's say, you know, Cytochrome 2E1 is interesting, comes up quite a bit because its main activity is actually in the brain. And guess what? The brain also needs to detoxify. It may be the most important organ to sometimes pay attention to. So anyway, this component of the Cytochrome 450 gene is most active in the brain. And where am I going with this? Okay. So if in a scan result, you know, let's say this gene comes up very high or even as number one, that still doesn't 100% mean that this gene needs to be treated in this session. It just means it's out of balance. Okay, so now it could be out of balance for a good reason. You know, it's very active and the software picked that up. Or it could be out of balance because it's not working right and there's demand for this gene to kick in and it's not, and the software picked that up. So the only way at this point that I know how to sort that out is with muscle testing. Of course, if you don't do it too often and too much, you are able to use this test single item function down here, okay? But you can't just go down the list, you know, I don't think. Anyway, I personally prefer muscle testing. But you could highlight this item and then test single item here, and it will measure it. And let's say anything below 50, you don't really need to treat it. Anything above 50, between 50 and 100, it needs to be treated, or it's a problem. Okay, below 50, let's say below 45, it's not a serious problem, you know, if you're depending on how much wellness you're working with here, how much you're just fine-tuning somebody that's already healthy. You know, usually people are pretty sick whether they know it or not. So let me see. Let me see what people are chatting so I can respond. Okay, there's a bunch of questions. Bear with me. Deanna, sorry about starting so early. We'll do a webinar soon, a little later. What if the percent rectified stays low after running corrected frequencies? Okay. Well, are there other frequencies interfering? I don't know for sure, but probably not. What it means pretty much is just that it's a more serious problem, that it needs more attention and more time. But what I would suggest is to So there's something to be said about the pulsating of frequencies, because as I was mentioning earlier, it's part of the body's survival strategy to be able to ignore things, because it cannot respond to everything all the time. And you really realize that once you realize how many infections everybody has. The immune system kind of works the same way. It's just literally keeping the lid on things, trying to keep you alive from minute to minute or day to day. And so if Epstein-Barr or Bartonella or human papillomavirus has been in your body for 30 years, and here we come along and we say, okay, immune system, let's get rid of this. It's not going to happen in one session. I mean, you're going to have to keep reminding this immune system over and over again. Okay, let's keep focused on it. I know you're very busy, but we're focusing on Epstein-Barr, and then you may have to come back, many times, depending on, if it's been in there 30 years, and that's not uncommon. That's rather very common. You're talking about 10, 20 treatments over time. Now you can always combine it with something else. You don't have to necessarily just do an immune treatment. So, do you run the frequencies again, or are there other frequencies interfering? So the interfering part, I'm not so sure of. But since we're talking about it, let me just show you something. Okay, you see this enable field validation here? This should always be on because this gives a EMF protection just for your computer area, for your computer, not for the whole world, but for right here. So make sure this is on. It's EMF protection built into just the software here. Okay, where was I? Was it here? Right. So, all right. So let's say you're working on B vitamins, right? And so one thing you should always do is use the quick cycle. Okay, that will speed it up. Plus, it allows you to bring in these combinations. For food items, you should always have. I would suggest to do at least those 3 digestive enzymes, generic DNA frequency, and all the major organs. If you want to get the nervous system involved, and hypothalamus. Often, if you think it's a protein copying issue, or if there's chronic viruses involved, you can add RNA. If digestive acids are part of the shortcomings, you can add that. BBF is body-brain function. In the show method, it's called MBB, which is mind-body balance. It's the same frequency. It's an emotional type of frequency too. In fact, the first couple of treatments, if somebody's new to this, you should always add this BBF just to open. It's a very intimate thing that we're doing here, accessing somebody's DNA, and of course for a good purpose, trying to improve it to functionally and harmonize its expression. But nevertheless, it's extremely personal and it's extremely intimate. So that's where this BBF frequency comes in. Or if somebody's really distraught or so, or weak, always add that as a stabilizer in so they're emotionally, or rather, not necessarily consciously. So this is all subconscious anyway, comfortable with doing this. So the quick cycle will emphasize these combinations, which are all vectors. Look at them at vectors, So rather than just talking to the genes that are directly involved with B vitamins, we're also talking to the factors that are involved in their digestion, okay, so including digestive acids, digestive enzymes, the generic DNA, and hypothalamus will be the nervous system, and the major organs. You don't have to use them all, but actually, if in doubt, it's always safe, really, to do them all. I'm a little bit more conservative about hormones. There it depends on, hormones are a little bit more critical and individual, depending on, you don't want to put hormones in like in a pregnant woman or a nursing woman, for example. The other thing about if the percent rectified stays low is that it just needs to be done again, okay? It means it's a serious issue. So as far as the show method is concerned, which really everybody should learn, I don't do it online yet, or not anytime soon, because it's really something that you have to practice on. It's good to be present in a group. It really is. Someday I'm sure we will, but once climate change makes it impossible to fly around anymore, then we'll have to do it that way. So anyway, sorry about that. Be not afraid of turbulence. So it will, if the corrective frequency is slow, it just tells you it's a serious problem. And so the combinations become important, okay? So it's a heads up that there is problems or deep problems, okay? So for example, the B vitamins, okay, the complex is all the B vitamins. So then, we have the single B vitamins. So now if you break it down into, let's say vitamin B6 really was the one that didn't respond, very well. That has a serious problem, or vitamin B12. Well, then and muscle testing again will kind of clarify that, but eventually it will come up in a scan too. Let's see. So now, you can get a little bit more sophisticated and start combining it with genes, for example. So MTR has to do with B vitamin 12 and folate, kind of methylation stuff. So now, okay. So hold on a second. Well, I really need to do this right. So let me clear this again. So let's say we realized that the reason why B vitamins are not rectifying really quick is because vitamin B12 is a particular issue, right? So now, and don't be afraid of this gene thing. It is complex. Yes, there's thousands of genes. But the sooner you start just using them, the sooner you will realize that it's okay, and the automation of the software will make it more and more possible to. It just makes it much more effective. Okay, so let me get rid of this. And okay, so let's say I want to focus on vitamin B12 because I realize that that's really the culprit. That's why things are sluggish. That's so now we try to find some genes that have to do with them. On top of my head, it would be MTR. Okay. So here is two genes that have to do specifically with vitamin B12. So then you bring them over here into this treatment basket, and now you specifically treat vitamin B12 at the epigenetic level. So I probably would still add digestive enzymes. I would skip the generic DNA because we have a very specific DNA frequencies now. So it's a judgment call. You can do two things. You can either muscle test or you can just use your judgment. So vitamin B12 is extremely important for the brain function. So why not bring in the nervous system, okay, hypothalamus. Okay, so that would be a minimum. So again, you would do a quick cycle, and now we can treat specifically vitamin B12 at the epigenetic level. And if these genes were actually involved, and if they're mutated or something, this will be a very powerful treatment, and it will change their function and harmonize vitamin B12 metabolism. Okay, hold on. Diana? No, she doesn't have her microphone on. Okay. All right, so let me go back. So yes, you can run the frequencies again. However, if you've done it 30 minutes, don't do it the same day. Do it another day, as early as the next day. Okay. And if they're from out of town or something, you could do it like a session in the morning and a session in the afternoon. We've done that a lot. But that's, if locality is a problem or time, you can always, these are all general guidelines, but really at the same session, this kind of thing, you have to give the body now 24 hours time to implement this change into all 100 trillion cells. It's an important part of the concept. It takes the body time to get that done. 24 hours is not much, but it's one cycle of life. So we're not, the place where this change is happening is in the nucleus of each cell. So 100 trillion cells, it takes a little time, right? So the general rule is 24 hours. So Diana also says, instead of going to the wellness page, why not just run a comprehensive page which has all the different categories? That would seem to be a good place to start. Well, as a matter of fact, by the way, you can save this thing. So today's date, and you can always come back and do it again, or you can come back and look what you did on August 6th. And anyway, that saves the treatment that you did. Yeah. While this, let's clear that. While this save button saves the scan result from up here, which we didn't run a scan. So as a matter of fact, generally speaking, unless it's a brand new patient or client, this is, I always run the comprehensive database because exactly it has, 2,300, now 2,400 items, from food items to basic genes to, of course, basic infectious pathogens, and so on and so forth, including some basic emotions. So this is a good place to start as far as, as far as changing genetic expression and it generally is concerned, metabolism, immune system, and so on. So the other panels are sort of more, of course, supportive, but they're also more acute. If you have, well, the thing is, if somebody walks into my office with acute back pain, low back pain, like yesterday, this client, and she thought, she couldn't afford, her car just broke down and she couldn't afford the allergy treatment type of thing, holistic treatment. So she just wanted chiropractic. And I'm like, I'm checking her out and I'm saying, look, there's really not that much wrong with your back. Your back is okay. It's a little inflamed, but it's not an alignment issue. You have inflammation, probably from the kidneys, and you really need a treatment for hay fever. And that will actually help you out pretty quickly, within hours. And so I was able to convince her, and it made me feel a lot better because I know today she's better. While the chiropractic adjustment just wouldn't have done the trick, really. So yes, this is the workhorse. I call this the workhorse. And then of course, once you run out of what you call it. Once you hit a plateau or something, you can come to the main reactivity test, which has, almost triple the frequencies as the allergen panel. However, more information is not necessarily always good because, it's also more confusion. But this is a great panel, and then you can narrow it down to different categories. which of the categories reacted the most. It just gives you more information. Plus, you can do like an acupuncture treatment at the same time. So by the way, so you right-click on here, you get the same feature. You can. But so you want to add to here. We were working on cholesterol. Like this enzyme here is the same enzyme the statin drugs. This is just in here from some previous discussion. So this enzyme here is the same enzyme that the statin drugs target to lower cholesterol. Okay. And so I somehow put this together. Oh, I think I put cholesterol into the search function, and these are some of the things that came up. So now let's say you want to add, while you're doing this, you want to add an acupuncture treatment. You want to put in bladder 10, and you want to put in whatever, bladder 26, and you want to put in large intestine 8, right? You can do that here in this panel. The allergen panel doesn't allow for that. It's got some Chinese medicine frequencies in there, but they're more generic. Okay, that's a nice thing about this panel here. It has more frequencies. It's got the all 360 acupuncture points. You've got miasms, which are really old-fashioned kind of genetic predispositions. That's what we were dealing with or working with, as little as 20, 30 years ago. Of course, now we're getting much more specific with genomics and genomic testing and so on. It shows you the enzymes as a category and so on. And by the way, here you can actually look up certain genes by alphabet, which is helpful. So great panel. While we're here, well, okay, never mind. That's a little bit too much. Okay, we're running out of time. So somebody was asking a question about cancer. Okay, how do you prepare to target the cancer? So that is such a loaded question, it's well known in my practice that we don't treat cancer. In fact, we don't treat any disease. That's why we're busy as heck, because everybody else treats disease and they're lousy at it. However, I don't make a secret of that we try to prevent or avoid disease by finding out energetically what the body is actually dealing with, and get rid of some of these infections before they cause cancer, before they cause disease. A lot of these autoimmune diseases like ALS and MS and so on have an infectious component to it, a chronic virus. Viruses live in our DNA and they cause genetic damage, and cancer is one of those. So my number one cancer prevention, let's call it panel, let's say, is to work out, to get the inflammation out of the body by harmonizing metabolism and then finding, the chronic infections and deal with them. And the only, so the general public is completely convinced or has been led to believe that if you have any of these things, the only thing that can help you is medical intervention of one sort or another. We can find all these things with testing, and then we can give you whatever, antibiotics, and now they even give these very expensive, Tamiflu and things for the flu virus. It's not only is it hugely expensive and ridiculous, but you're doing your immune system, generally speaking, okay, with exceptions, a disservice, because it will get weaker and weaker and weaker. You can't just every time you have a virus take a virus suppressing drug, and then the immune system is able and capable to get rid of a common flu virus rather quickly. And the same is true for Lyme and blah blah. We do have an immune system seminar, coming up here in Syracuse in the first weekend in October. where we talk about these things. So prevention is what it's all about, and and the entity that does that is your immune system. Okay, it will get rid of these viruses. Anyway, yeah. So preparation. All right. However, if you insist on working on cancer, let me show you, and there's more coming. I don't know whether that's a good thing. So in the chromosome panel here is, so here you can actually measure it, okay? And down here, there's really only one. There may be others, but only one that starts with cancer. But there's others that anyway, use that panel. It's a great panel. Once you are kind of, once in a while you run into a plateau, with the allergen panel, and so these are great frequencies, okay, and there's lots of them, and you can measure this. You can do a scan and then do a feedback. So we have a few cancer frequencies in the allergen panel. 9 out of 10 times I just really ignore them, but it's not willfully, I speak from just muscle testing experience. Rarely, let's say there's a cancer frequency is in the scan result. Rarely does the body say, yes, treat me for that, put that in the treatment, but the most cancer frequencies are here. Where are they? So on the diseases, you can see diseases here, and you go down to C, and they're spread out, but there's a whole list of them, rather semi-comprehensive, even though we're learning a lot about cancer, thank goodness, with the immunotherapies, So that's what I do. That's what I'm focusing on. What the same thing that the scientists are focusing on with immunotherapy, trying to identify the immune factor which the body, the person's immune system has developed to fight that cancer specifically, because it's a very specific thing. And that's why there is not a protocol for cancer, because it's so many different cancers. And then, well, developing the frequency for that factor is my challenge. And then treat the body with, epigenetically upregulate the production of that factor so the body produces more of it faster by making these genes work better and supporting them energetically and nutritionally. And, if the cancer hasn't gone too far, that's the answer to win that battle and turn things around and basically heal it up if it still can't be healed, So really, that's all I've got to say about cancer. My big thing about cancer is prevent it while you can. And I am developing a seminar about specifically cancer, but I don't even know if it's going to be ready next year, maybe. But because, as I was saying, I'm doing the same thing as the research, the epigenetic research is doing with the immunotherapies of, again, identifying the body's own specific defense, and then so what the new biotech companies do is they take that factor out of your body, take it to the lab, ferment it, and make copies, millions of copies really fast within 10 days, 2 weeks, and then re-inject all these copies of your own innate immune factor, and that attacks very specifically that cancer. And that's when they have success with it. And, so science is moving forward. We are getting smarter about these things, and the guidance comes from the body, and then it works. All right, well, very good. I hope I got some let me see, Crystal. Okay, Crystal.
Dr. Strail?
Yeah.
I know I came in a little late. Did you talk about the vaccines any in the detox section?
Oh, I did. Yeah, I did.
Okay.
Well, I am recording this, at least most of it. So I'll be posting. I'll let you know.
Okay.
By the way, somebody asked me about, imprinting the bracelets and all that. There's actually a video coming out this week specifically about that. So just stay tuned.
Okay.
Crystal, I did do the single item, I prefer the muscle test, but yeah, that's how you do it. So let's say, I wouldn't do that myself because it's just not good enough in my book. But if you wanted to, this is probably a bad example, but you could do check single item, on breast cancer here, and get a number. And so what do you do with this number? It's in the middle. So not yet would be my interpretation. So you're really back to square one. Now, if it was 99 or in the 90s or in the 80s, it's something, you have to think prevention until, you really are at a medical diagnosis, and then everything changes anyway. And that strategy we're working on after that. So Crystal always asks, when running the allergen panel, are the top 3 color-coded items that are most out of balance always an allergen? So the answer is no. No, that's just it. They're out of balance, but they're not necessarily a problem. Whether it's an allergen, whether it's the only time when you really can pretty much, 99% take it that it is a real issue is with all the pathogens, virus, bacteria, parasite, fungus. It's very close to 100% accurate. They're there not because whatever, but they're there because they're in the body. And then the question is, then you can't treat everything. So you want to work in layers. If there's a bunch of viruses, you do the viruses. If there's a bunch of bacteria, you do the bacteria. And you may have to come back and do the viruses another time. The reason for that is there's different genes involved in eliminating these different categories of pathogens. So if you talk to everybody all at the same time, the body is less likely to do a good job in executing what you were asking it to do here energetically. We'll be talking more about that at the seminar. So yeah, look at the Smart Health website, and there's a Smart Health newsletter in the queue. It's going out hopefully tomorrow morning. There will be a link for a muscle testing tape for training, where you can teach yourself muscle testing and some other news and stuff. All right, so